Thanks, Ruth. Hi, everybody. I'm Lana Lee Jackson. I'm the Head of Patient Experience here at Nottingham University Hospital's NHS Trust. We're really fortunate to have two projects shortlisted in this category, so you might have me back to back, I think, for the next 15 to 20 minutes or so. So the first project that I'd like to share with you is our Experience of Care Shared Learning workshops. If you could just go to the next slide, please. So a little bit about our organisation. We're based in the heart of Nottingham. We provide services to over 2.5 million residents and a further specialist services for a further 3.4 million people. We're one of the largest employers in the East Midlands with almost 17,000 staff. We have 90 wards and around 1,700 beds, so we're a large acute trust. And we also have a really good national, international reputation for many of our services. Next slide. This is just a copy of our team NUH values. This is a big part of our culture in the organisation and something that's instilled in all of us working for the trust. Thanks, Ruth. So just picking up where I left off. So we're a large acute trust in the East Midlands. I joined the organisation in September 2019, and I've just celebrated my 2-year anniversary with NUH, working in our complaints and patient experience team. So we're a medium-sized team, and we sit within our nursing directorate. We're accountable to our chief nurse, but we work very closely with our medical directorate, including our patient safety and effectiveness teams in quality governance. So just bringing together those pillars of governance between experience, safety and effectiveness. We have a real robust operational work plan, which focuses on our delivery of our services against the National Patient Experience Improvement Framework, but also the CQC key lines of inquiry. And we support a number of services and teams in the organisation to de-escalate and resolve concerns and complaints. We also work with a number of teams and services around how they can improve locally based on patient feedback and comments and suggestions for improvement. So that includes feedback through our national surveys, local surveys, friends and family test, as well as online feedback platforms. We gather a number of different pieces of feedback through a number of different routes, and one of the key roles that we have within our team is to make sense of all of that data and information and to try pull out any emerging themes or any areas, hotspot areas where people need a bit of extra support to improve patient experience of care. So this project initially started through our work with the PICA Institute Europe for our national surveys. Many trusts work with PICA, and this is part of the National Patient Survey Programme that is coordinated by the CQC. Whenever a national survey results are published, we receive early feedback from PICA to give us insight into what the data is showing, and that gives us the opportunity to consider the latest survey findings and feedback and to consider how we can improve our services more locally. Next slide, please. So what we set out to do is to improve our approach in driving quality improvement and facilitating shared learning in our organisation, and to create a safe space where people can reflect on the survey findings and to consider what that means for not only their service but for the wider organisation. We also wanted to adopt a quality improvement model in patient experience so that we could triangulate all of our data and information and intelligence together, and that would then stir or strengthen our ability to identify any emerging trends, themes and areas to prioritise. We were very adamant that we needed to improve staff and patient involvement and engagement, and we've got a very active patient participation group in our organisation, and they were central to helping us get our shared learning workshops off the ground. And we also wanted to co-produce improvement action plans with our divisions and services, but we wanted to go beyond just producing action plans for the sake of action plans. So this was very much about wrapping around some support and discussion and giving people the tools to move their action plans forward and actually to deliver some meaningful change. The next slide. So our shared learning workshops aim to provide a safe space for open discussion. So that's the ultimate goal, really, is to create a psychologically safe environment where people can openly discuss the findings, that we can talk about patient experience, feedback and insights about the services we provide, and that we see things through the lens of not only the patient's experience, but also the staff experience as well. And we ultimately want to support our staff to understand the data and information. So what we do is we not only reflect on the national survey latest results and findings, but we also triangulate our data and information relating to patient experience. And we look at 6 months to 12 months worth of patient experience data, and real-time, near-time feedback as well, to gain insight into what people are telling us about our local services. We encourage staff to use the feedback to support patient choice and personalisation of care, and to think about the local improvements that they can do. And we encourage people to think small. This doesn't have to be big or massively transformational in the organisation. We encourage people to think about the little things that they can do within their areas, because often those things have the most impact on improving experience of care. So this was very much a joint venture between our Insight team, our patient experience team, and PICA Europe. And we definitely, through this experience, have identified a number of things we do exceptionally well, and it gives us an opportunity to really celebrate our successes, and that definitely boosts everybody's morale, especially during the COVID period. And then we also very much explore the ways in which experience of care can be improved, not only in terms of general experience, but from a safety perspective, and also at every touch of the patient's journey and pathway. We also involve patients, families and carers into the workshops, and on some of the ones that we've run more recently, we've had patients attend with lived experience on the service, and that's been extremely powerful to hear firsthand from patients who have gone through that journey. At the end of the workshop, we work to produce an experience of care quality improvement plan, and that's really a plan that our divisions can work to try support delivery of local action, and to keep on track with how that's progressing. And really it sets out individual action owners so that it's a shared action plan, rather than them having to produce that from scratch. We do a lot of that work within our corporate team. Next slide, please. So what we have achieved and what makes this initiative special: all the workshops have been routinely well attended by both staff and patients, and we ran an initial pilot in our maternity services in December, which was hugely successful. This has resulted in us now adopting the approach permanently, and we've set up a forward schedule for this year. The initial pilot feedback was really positive, and staff shared that it definitely gave them the opportunity to consider patient experience of care, and 90% of attendees strongly agreed that they learned about how to improve experience of care from the workshop. On the back of the workshops as well, staff have made pledges in terms of how they will improve patient experience. So we've incorporated pledges into the action planning model. And like I said before, the workshops are run in partnership with patients and staff, and collaboratively facilitated between ourselves and our patient experience team, our information insight team, as well as PICA Europe. So we have adopted a quality improvement model and methodology in our learning and improvement, and our workshops really bring together patient experience, quality improvement and co-production for open discussion, reflective practice and shared learning. Next slide, please. This is just an example of some of our upcoming workshops that we've got planned in for this year. And I believe one of our workshops is actually up for another award, which is the Home from Hospital program, and that workshop again was over very, very successful, with over 80 attendees on the virtual session for that one. And I think that brings me to the end.